welcome to our third nutrition policy dialogue. This policy dialogue is organized by the Eminence and supported by the GAIN Bangladesh. We are organizing this policy dialogue to do something for the nutrition issues in our country during this COVID epidemic. Today we have three guests. Our first guest is John Taylor. He's the Chief Technical Advisor, FAO Bangladesh. John Taylor is working in FAO for the Food System Project, and he's based in Bangladesh since 2016. He is an urban planner who has worked in Indonesia as well as Africa and Latin America. Welcome, John, to our webinar.
Thank you very much. Thanks for having me.
Our next guest is Rezaul Karim. He's the head of the program WFP Bangladesh. Rezaul Karim has more than 30 years of experience working in the areas of food security and nutrition. He joined in WFP in December 1992 and served in various program positions and involved in the overall management of the program. He, as a head of the program, is currently responsible for coordinating capacity strengthening activities of WFP Bangladesh and working closely with the relevant government agencies in improving the design and the implementation of the social safety net program. Prior to this joining WFP, he has worked in the care for the 6 years, and he's married and has one son. Reza bhai, welcome to our program.
Thank you for inviting me as well. Thank you so much.
Now our next guest is Dr. Ziauddin Haider. He is the Senior Health and Nutrition Specialist working in World Bank. He is now based in Cambodia. Ziaul Haider is a cluster leader for health, nutrition, and population in the global practice in Cambodia and Laos. Prior to joining the World Bank Group, he occupied leadership positions including Director Research in the BRAC, Senior Nutritionist in the IAEA Vienna, Manager Special Program for the GAIN Geneva, as a director also Sprinkles Global Health Initiative in Toronto, Food Security and Nutrition Expert in FAO Bangkok. He was trained as a medical doctor with a master's degree in the food and nutrition planning and PhD in the nutrition epidemiology. Jabai, welcome to our program.
Thank you, Shamim. I'm delighted to be with you this afternoon.
Let's start. John, we're going to start with you. As you are, have experience in the urban planning and you have experience in the food programming. Can you just share with us that what type of activities being implemented by the FAO in urban areas as well as in the slums areas of Bangladesh?
Great. Yes. So just to begin, so I'm leading a project that is just beginning, maybe I would say 10 months ago. So we're just at the beginning of a 5-year cycle, and it's called the Dhaka Food System Project. So the idea is to look at how people access food, but from a food system perspective, meaning in a much more holistic manner. And of course, the food system extends all the way back to the countryside, to farmers. But when it comes into cities, I think there are particular characteristics about urban areas that makes the way that people access food, the types of food, the choices they make about food distinct. And I think that we're trying to first understand a little bit the peculiarities, the unique qualities of Dhaka. Over the last 2.5 months during the COVID-19 crisis, of course, this has been a little bit more difficult, but we have been collecting information from about 150 slums across the city, the 4 cities of Dhaka, to understand sort of how prices have been fluctuating for different food items. We've also been calling weekly to community leaders in these different communities and just getting a sense of what is happening, how they are coping, what are the challenges they have, and then also, a perspective from the ground up. And in doing so, we've been producing these kind of like weekly situation reports. So during the crisis, of course, this has been a bit more limited, but we were working on this actually as far back as sort of November, October last year. So we did a bunch of research with the urban poor communities through the Dhaka Urban Poor Federation, and we learned a lot about the food security issue in slums. Of course, for example, how the poor cope with food insecurity, what are some of the challenges they have in accessing food, and we presented this research at the World Urban Forum earlier this year. So with the knowledge that we have kind of come together, we're trying to find ways to improve access to nutritious, affordable, and safe food for all, but focusing particularly on the most vulnerable. This might be in terms of promoting urban agriculture, helping to start up food-related micro-enterprises, helping to pilot street vendor regulations and organizing street vendors, raising awareness about nutrition for the urban poor, and building the capacity of poor organizations, poor community members to make the right choices about food. And at the city level, I think this is important because this is a governance issue, helping city governments to have a policy, have a strategy on improving food security, and understanding enough about the urban poverty situation to be able to take those informed decisions about what to do. And I think, this is actually an area where we can really point to lessons related to the response and to the way that food aid has been distributed, because I think that is a very kind of relevant. It's very relevant that there has been a blind spot there, and I think that speaks of kind of issues of urban poverty in Bangladesh.
I'm just thinking that, as you are describing about your programs, what you are going to start, when you design this program, or as you are planning to implement this program, at the design phase, did you consider COVID-19, or as the implementation is going on at this moment, are you going to cover these issues of COVID-19 within your program?
Oh, I don't think anybody really expected something quite like this, but I think the relevance of COVID-19 is that it brings to the front a lot of those issues that remain, either ignored or little discussed. And the reason why, the poor are most vulnerable to some of the disruptions in the food value chains, or more vulnerable to some of the safety and nutritional issues, is because there are a whole lot of other issues that come with, urban poverty. The fact that there's very little infrastructure, services, there's, the vulnerability or fragility of the informal economy, access to health, education, those kinds of things, I think are very much part of the nutritional issue. And so while we did not expect that, I think the COVID-19, I think that we understood that there were a lot of other issues, some of them governance issues, sort of policy issues, some of them more sort of structural, infrastructural issues. And there's really not enough attention being given to that. So I think that it's very important that something like this can help bring up those topics and put them to on the table.
Yeah, Reza Bhai, as John mentioned that, as FAO has some initiative, I know that WP is doing lots of activities for ensure the access of the food for the mother and children. I just want to hear about something that what WFP is doing for, nutrition issues for the children. I heard that WP has a program for feeding the children, like a school feeding children program that is initiated a few months ago, and maybe it is in a large scale you will implement in the near future. But at this COVID period, you look at that, the children are not coming to the school. They are going through a poverty perspective in terms of their parents' livelihood issues. So, what type of intervention or school feeding programs you are thinking in this case of COVID-19, and how you're thinking to ensure the access of the food for the school children?
Thank you, Shamim Bhai. I mean, just to begin with, yes, as you mentioned, school feeding, but again, just to begin by saying that what is the dimension of the program? Like school feeding is not WP's program, it's rather the government's program. Because at this juncture, government is assisting almost 3 million children in high poverty prone areas, which they call it 104 sub-districts, which also includes urban as well. Because if you look at the total preschool and school children, the magnitude is 17 million, but government is able to assist 3 million of them, and of which like more than 200,000 is in urban. And then what happened, like government has approved very recently a policy that entails that they will not only distribute, currently the school feeding means each student coming to the school will get a packet of 45 biscuits, 75 gram, which gives them 138 kilocalories, 67% of their daily micronutrient requirements. It's more of that type, but government has adopted the policy through which they will move from more from biscuits toward school meal. And then the good thing that I wanted to tell you that the policy that government approved has really a very smart move there, because they are saying that the meal that they will provide will have 30% energy intake, and 50% of the recommended macronutrients should come from those meal. 10 to 15% energy comes from protein, 15 to 30% energy should come from fat, and out of 10 recognized group, the meal should be of consisting of 4 food groups. So it's more of a nutrition-rich program that they are thinking of. But so it's a school feeding program owned by the government, WP more or less providing technical assistance. We indeed implement some school feeding program in Cox's and Chittagong hill tracts, but nevertheless, our caseload is not is about 200,000. So the program is more towards the government, but inward, and it goes across. The government wants to really introduce this program not only for rural, all 17 million pre and primary school children, both in urban and rural. As I said, at present, more than 200,000 children are receiving assistance in this in urban area. But in response to COVID, what we have done, particularly the ministry has done, I would rather say that Ministry of Primary and Mass Education, because the schools are closed since 17th March. Then, I mean, what they have done, we were working together with Ministry of Primary and Mass Education, devised a guideline, and as per the guideline, the biscuits that they used to receive in schools, they have delivered all these biscuits to home of the children. It's more of a home delivery that we have adopted. And children are very happy that at least, I mean, they can, at least that helps them to have bit of a meal there and biscuits and others. So in response to COVID, and there has not been an expansion of the program as such, but certainly the Ministry of Primary and Mass Education, with support from us, like have delivered those school meal biscuits at home. Each 3 million children has received those biscuits at home. And then this is a great help when, you know, like when people are suffering from not having enough diversity in their meal because of the drop in income and others. So that would be very helpful to have a bit of a supplement with macronutrient with macronutrient fortified biscuits. So that's at this stage. I would say that that's that. In response to COVID, as I said, it's only delivering biscuits at home, which I think is an excellent step that government has taken up. For future expansion, government indeed, as per the approved policy even before pre-COVID, they want to expand the program. They started introducing school meals for about 500,000 children. So government is thinking that they would move towards a school meal program, not only for 3 million children, but also they want to reach gradually to all 17 million children, of which perhaps 3 million children will be in the urban, will be receiving the same assistance. That's what I want to say about this one. Yes, thank you so much. Shamim Bhai, I cannot hear you.
As you mentioned that during this COVID period, a government has taken initiative to provide this biscuit at their home, and that this government also said that school will be closed up to the September. So this is a very 4 or 5 months, 4 months time. they're going to provide this feeding for the children at the home. So my point is that as we know that the governance issues and distribution issues related to the relief, and in that case, for a school biscuit distribution, is there any monitoring system to ensure that children are getting their food at the home?
Good question. I mean, I should have mentioned about the government guideline that what we said that each box will be delivered and they should collect a photograph of the box because we have developed guidelines which is especially for home delivery. It has measures so that we can reduce exposure because of the COVID, and also we have documentation that this biscuit goes to the houses. So the requirements for cooperating partners who are delivering particularly the NGOs delivering the biscuits at home, and they must leave the box in front of the house. Someone from the house will collect that box, and then they will keep it for 2 days, and then they will eat. There are specific guidelines prepared, but we asked the cooperating partner NGOs to keep a record of the photograph that for each of the box delivered at home. So this is one, and at the same time, Ministry of Primary and Mass Education because they have all the telephone number for the students now. So they on a random basis they are calling them to ensure that they are in receipt of that. In places where WP is distributing, we are also going back and calling them. But nevertheless, we have started this, and monitoring findings are not there just to confirm that all has taken place the way we planned. There could be issues, but so far we know that we didn't get any feedback. Rather, only one sort of thing that we are hearing that in case of delivery, instead of going to the home, some NGOs perhaps is asking children to come. But again, we cannot substantiate this. We do not know because we have started monitoring. We do not have the monitoring information available now to say that how it went. But the information that we get from the field, and also you may have seen some reports in the newspaper, also Facebook, there are very high acknowledgement of the importance of this program and appreciation of that they are receiving biscuits at home. High appreciations is really weak so far the feedback that we have received. Once again, we do not have the monitoring information at this stage to share. We will have it in a week time perhaps. Thank you.
However, we should congratulate WFP and government of Bangladesh for taking this initiative. Let's go to Jia Haidar Bhai. Jia Bhai, you have a vast experience to work in Bangladesh, and you know all the part of the nutrition situation in Bangladesh. And you have also now you are working at Cambodia, and you are responsible for Laos. So we want to know from you that what is your understanding that how COVID is going to have an effect on nutrition in Bangladesh as well as in the global arenas.
Thank you very much, Shamim. I was very passionately listening to John and Rizal Bhai, the respective programs from IFO and WFP. Now, let me put this discussion, as you rightly mentioned, in the context of COVID. At the World Bank, every day we publish daily updates. I have some figures in front of me. During the last 24 hours, globally, we have 97,341 new cases and 4,980 new deaths in the last 24 hours. That brings us the total confirmed cases globally, 5.6 million COVID cases globally, and the global death is now 3.5 million. So, it's 355,535, which is actually increasing every day. Let's come to Bangladesh. In Bangladesh, until now, we have total confirmed cases 38,292, and the death is 544, and this is continuously jumping upwards. So right now we are kind of talking within the context of a very dangerous situation, and we don't know to what direction the world is moving. Now let me come back to nutrition and link to urban nutrition. In Bangladesh, especially in Bangladesh, the urban nutrition is becoming more and more important. In the last over 10 years, the urban population increased by 35% in Bangladesh, which is like per year, over 3% increase per year. And if this rate continues, the urban population will be half of the total population in Bangladesh will live in urban areas by 2050. So this kind of tells us how important it is for us to think how we can provide good nutrition, health and nutrition to urban population. The major challenge in urban population is in terms of nutrition, we have to deal with both, extreme of malnutrition, both spectrum of malnutrition. One is undernutrition, which is right now in Bangladesh, we know that over 1/3 of the total under 5 children, they are suffering from chronic malnutrition. And if you look at the numbers of wasting, which is the weight for height, which indicates short-term malnutrition, the rate is now 14%. And very interestingly, when we feel proud in terms of poverty reduction, we really feel proud globally. The World Bank president went to Bangladesh in 2015 to celebrate the poverty reduction because over the last 20 years, Bangladesh reduced poverty from 44% down to 18%. But looking at the malnutrition figures, this 34% chronic malnutrition, this is way above than the developing country average of 25%. And also the 14% figure of wasting, it is way above than the developing country average of 8.9%. So there are a lot of reasons why, as Bangladeshis, we should be very, very worried, and especially looking at the malnutrition numbers. Now, coming back to COVID, the COVID is disrupting our life, it's changing the way we behave as an individual, it's changing the way we behave as a family, it changes the way that we behave as a society. It has changed the way health system has been functioning in Bangladesh. To be very specific, it is disrupting our entire health system from two broad angles. It is disrupting the demand side of our health service, which is pretty much linked to nutrition service. Number one, through restrictive movement. We are introducing a restriction, lockdown, social distancing, and this has enormous impact on how people access health service or nutrition service. It is affecting the demand side because of the lost income. Hundreds and thousands, I would say millions of people in Bangladesh, especially in urban areas, they don't have job, especially the daily laborers, low-earning people, because of the social distancing, because of the lockdown, they don't have any cash income. So that's a huge challenge. And the third way, it is basically affecting demand side is the concern about people's concern about being, infected. So if a woman and child, they're supposed to visit a health center today, they wouldn't go because they are pretty much scared that they may contract COVID. Also, they have a perception that, they may not get the service, even if they somehow rush to a health center. Now, the other side of the coin is the supply side. We know that because of the COVID, the entire health commodity supply chain has been, broken. All the drugs, essential drugs, medicines, nutrition supplements, everything, the supply chain has been disrupted. So many of the health facilities, health centers, where women and children used to access all the nutrition supplements is not there. You know that many of the healthcare workers, they are already affected by COVID, and they are in isolation, and many of them actually dying. So the Bangladesh, the human resource for health and nutrition, is already crunched, and they are further affected by COVID. And also we know that overall management, how the health system is being managed, the entire management chain has been disrupted because of COVID, and you can see that into how the health system is being managed over the last couple of months. So these are I just tried to mention some important elements, how COVID is disrupting the entire health system, disrupting the nutrition service delivery, And maybe at a later stage, when you come back, I can tell you, I can share some estimates that the World Bank, we have already done some analytical work to understand what will be the potential impact of all these disruptions in health services on various aspects of service delivery. Maybe I can come back at a later part of this discussion. Over to you.
Yeah, but just, before going to again, John, I just one issues I like to, share with you. You know that, in terms of the newborn child up to 6 months, we said that children, a newborn child should take the breastfeeding, exclusive breastfeeding. And lots of, WHO recommended to do the breastfeeding during this COVID-19. But a day before yesterday, I saw one article that one case they found that breast milk also may transmit the COVID-19 too. So if it is come up as a scientific areas, then what will be the situation you think that in terms of child breastfeeding program?
Sharma, it's a good question, but I don't think I have an answer because COVID as a new disease, we know very little about it. We know very little about its transmission. You said you just read yesterday that breast milk can potentially, coronavirus can potentially be transferred from my mother to child through breast milk. And also, it's not just breast milk; it can be transferred, through mothers even breathe. When the mother is breathing and the child is coming very close to, mother's, nose and mouth. So potentially it can also be transferred from mother to child if the mother is infected through breathing or coughing, and I think I'm not in a position to make any suggestion whether a mother with COVID or a COVID positive mother should breastfeed. And if not, what will be the alternative measures? I think this is something we need to discuss among the scientists and also, the breastfeeding experts. They need to, put their heads together to come to a solution or come to a recommendation on this aspect. I don't think right now we're in any position to recommend this type of issue.
Thank you, Javed. John, let's come again the point regarding the food production. You know that recently our agriculture minister and other government bodies said that we have produced lots of grains and we don't have any problem in terms of the food production. Maybe some sort of surplus we have. But what is your understanding, in terms of the production? What is your projection that what can happen in the next coming years or end of this year? And another point is this type of pandemic when happen, then food production may not be a problem, but food access is a big challenge. So in that case, what type of short-term effect and long-term effect we can face for this COVID-19 in Bangladesh?
Thank you, Sharmin. So I would say clearly there's been a lot of disruption to the food supply chains. And I think that it's important that there is transportation and that those transportation networks are rehabilitated as quickly as possible because farmers need to be incentivized to put seeds in the ground, and they need to get inputs in through ports. And I think things are slowly starting to get back to normal, but it obviously requires a lot of government intervention and coordination. And I believe that that is a huge challenge for the country, even though maybe in the short term that there are food supplies and stocks. That this is certainly not something that's going to go away very quickly. But one thing that I think this COVID crisis has really reminded me and maybe shown everyone is how vulnerable the poor are to any kind of disruption in livelihoods and just fluctuations in prices. And I think this is sort of a critical issue when we talk about urban slums and the urban poor is that any kind of disruption that they experience is going to have a huge knock-on effects. And there's just not. I mean, we're so reliant on these supply chains that it becomes the impact is almost instantaneous. What is necessary for the short term? Well, I really think the food distribution programs, be them subsidized or just simply giving the poor food or cash transfers, those are incredibly important. That's a lifeline for people, and I think WFP can talk a lot about this. Those things have to come at the right scale. And having followed the response to the crisis, I think what is apparent to me is how often there is a very limited understanding of where the urban poor are, who are the most vulnerable and most needy, how much is needed. And there have been very significant gaps or shortcomings in the food that has been distributed. And I don't think it's necessarily that there's not enough food. I think it's just that it's not being targeted, it may not be monitored, communities have not been involved to the extent where they should and could be, to ensure that those people who really need it are receiving it. And so I think there's a lot that we can learn there in terms of improving how we distribute food, such as better coordination between different institutions and levels of government, better targeting, better understanding of where the poor are, and just allocating resources to where they're most needed. Another kind of issue that we've been seeing is that while there has been adequate food distribution in, say, Dhaka North and areas of Dhaka South, Narayanganj and Ghazipur, which form part of Greater Dhaka, they have hardly received any. And those governments are really struggling to be able to supply food to the poor. So the kind of that to meet that short-term need is going to take a lot of coordination, a lot of analysis, and working together with poor communities to be able to satisfy those urgent needs.
Just one supplementary point, as you said that we are almost confirmed that there will be a disruption for the transportation of the food bring from the village to urban areas. And my assumption is that if you look at that livelihood and job opportunity perspective, lots of people are going to lose the job because this lockdown and other situation. So people may try to do the business related to the food too, because this is the only things you need to survive. So my assumption, maybe food price may increase in urban areas. So middle class people will suffer a lot due to the food price, and urban slums people. So what is your assumption regarding the food price?
I'm sorry, can you just repeat the last 10 seconds there?
Yeah, I'm just thinking that food price may be increased in the urban areas, and middle class people will suffer a lot due to this food price, and slums people too. So what is your assumption? Do you think that food price may increase, due to this COVID-19?
Oh my God, we've been looking at this week to week, and the prices have skyrocketed. I mean, it's extremely, the impact has been, you can imagine, devastating on those who have very limited resources. And I think that, the impact has been, one, that poor families have taken on an incredible amount of debt. And I think this has a lot of repercussions, not being able to pay rent. It's now even, having an impact on those people who rent them the homes. The second is where poor have the way that the poor tend to cope with shortages of food is through not eating. And so this is having a massive, ramifications on not just, the ability to function healthily and to have the right kind of nutrients, but also for your children and future generations. So I think that the way that the food prices have responded is, of course, they've risen, and this is really, of course, it's now starting to affect wealthier people, but the poor immediately feel that, and even those kind of sources of protein that maybe have not been, or chicken, for example, the price has gone down at some points and kind of goes up and down, but the poor are unable to even buy. Many of the poor are unable to buy chicken, even though the price may have come down. So what we are seeing is that the majority of the urban poor have basically switched to a diet of rice and lentils, or maybe one vegetable, but really has become, and many are just eating one meal a day. And so you can imagine the kinds of choices that parents make in terms of providing for their children, or for their families. It's very, very concerning.
Yeah, thank you, John. Reja bhai, as you are engaged with the WFP, and you know that government has taken lots of safety net program. That program they had earlier too, before the COVID-19. My point of discussion about that, are you satisfied about this safety net program? And how do you think that this safety net program, how we should expand up to the slums level people, and especially for the poor people in urban areas? Sound type corner. Sound type.
Yeah. Thank you, Shamim. Just in general, let me look at my document. Yeah. In general, to be honest with you, if you look at the Bangladesh has a policy called National Social Security Policy, and then the policy is quite smart. Huh? It has emphasized on life cycle approach and quite a ambitious strategy that the government Bangladesh has approved in 2015. If you look at the budgetary side of it, at least $3 billion is allocated for safety net program. So Bangladesh is quite committed and has strategies in place. There are issues, however, though, that implementation of these projects and which the systems improvement others are ongoing. So in general, Bangladesh has high commitment for social protection, and there are dedicated resources. But just I wanted to just repeat some of the things perhaps John has mentioned, is that like this COVID. If you look at our earlier version pre-COVID, is that we used to say that 20.5% are poor, 10.5% people are extreme poor. But this COVID has really changed the dimension of the poverty. How it has, it has increased perhaps also the people who used to be upper margin, and they are trying to fall down because of the economic, the drop in incomes, which is significantly. Many studies, some of the early studies suggest that the income gap is the reduction in income is quite significant, and that leads to compromising food consumption of the household. People started skipping meal, they do not diversify the food as they want to. But what I wanted to say that these numbers are increasing, but there is one group that John perhaps said, but let me repeat that just for clarity, is that there is a group which is called emerging new poor, like the rickshaw, the vendors, the small low income group. This is emerging as a new poor, which BRAC and the Power Participation Research Center like PPRC has said that vulnerable new poor. That is really a concern now, and many of them are in urban. So the evolving factors are that the social protection, the national social protection strategy that government has is primarily for the rural, but the poverty dimension is like, if you look at the COVID impact, a new poor are coming, and it is more in urban than in rural areas. So the existing system of response is not there to target those new evolving poor. This is one dimension. This poor is coming also in urban. Urban is also not the scope of the strategy that government has. Indeed, the government has included new interventions such as they introduced the open market sale for the urban, which was not there before COVID. And you know that the government is also giving, the Prime Minister has also given this 2,500 taka to so many people, 50 lakh people. So these are new interventions that was very helpful for the urban areas. But the issue is, I mean, government is doing the best that it could do, but and it has its financial space, whatever it could offer. But if you look at the recent studies, that the amount of resources that they recommend should be given is far more than anybody can really think of making such contributions. It's a huge. So my question, the issue is, yes, government is perhaps doing the best that they could, but I mean, the existing mechanisms are not there for urban. So government has to think in future that how to put together a strategy for which we want to contribute also. But then more importantly is that the gap is so big. So perhaps we have to find other strategies like the reach and other affluent people has to contribute. So this is the magnitude of the requirement and the extent at which government could respond to. There is a gap, and I am not sure that we can all say that it's not adequate. I mean, it's a challenge. This is such emergencies we have not seen before, and there has not been a strategy taking this into consideration. So this is a new challenging era now. Yes, government is doing the best that they could do. The requirements is much higher than what perhaps the financial space would enable us to enable the government to do it. So at this stage, I would say that the gap is enormous, but nevertheless, government is doing the best that they could do. And few things are emerging that the social security strategy, which was meant to be for poor, we must have to have a strategy for focusing on urban areas. And also, I mean, we have to design, perhaps the government needs to look at how best they can respond to this new emerging poor, so that we can prevent to have nutrition situation, the poverty situation goes up so rapidly. The only thing that I want to also add, and like, and then John and Jiavai has mentioned that, like the Bangladesh has done quite good job in reducing stunting. But then again, that the poverty comes, it's so hard now. So we are afraid that perhaps the discussion on nutrition may be again left behind, and we really busy on seeing that how can we really help reduce poverty. But certainly poverty is one of the dimensions that leads to malnutrition. But nevertheless, there are other issues as well. So you have to change in strategy as well. So these are the issues, like, yes, it is adequate. Government is doing the best that they could do. Gap is so big under these unprecedented emergencies. I mean, we have to look at how others can also contribute, particularly the rich and affluent, and also how can we benefit from and local engagement. Thank you so much.
Reza bhai, one of our Facebook audience, he asks that as WFP do work in rural areas and other part of the country through the NGO partners, but in urban areas, is there any NGO partners of WFP? Or if not, that we know that he mentioned that there is a very small number of NGOs working in urban areas. So what should be the WFP strategy to reach the poor people in urban areas?
Like for us, I mean, primarily, I mean, even look at the school feeding is primarily done by the government. Our position there is more of providing technical assistance, as certainly NGOs are involved there, like the ESDO involved there. We are looking for future opportunities of working with urban, but again, our position is more to complement government efforts. So perhaps, I mean, NGO will be coming, and there are NGOs, like we're also discussing with NGOs like BRAC and others. But again, I mean, I think NGO has, our experience in urban is, yes, I mean, there are NGOs to work with, not necessarily that we need to struggle for that one, but more importantly, I mean, we have to really look at platform that government creates, because government has only one program, it's called Visibility Allowance in urban. Government has the other program called Lactating Mother for the factories and others. So we have to find ways to make use of this platform robust enough and able to cover the additional needs. So I think NGO debate would come, but more importantly now is the challenge is to identify the issues, identify the resources, and also the correct platform to respond to. Thank you.
Thank you. Jia bhai, let's share with us that how World Bank is responding to manage the nutrition issues during this COVID-19 pandemic in Bangladesh as well as in Cambodia and other countries.
Thank you, Shamin. Before I go into the specific question, let me first tell you what are the consequences of this current, COVID situation on overall health and nutrition in Bangladesh. As I mentioned earlier, last year we did an analysis of last two rounds of DHS data, demographic and health survey data, to understand what are the major factors associated with malnutrition in Bangladesh. And we found quite a range of factors, but I just want to highlight four factors here. The first one was childhood disease control. It is highly associated with chronic and acute malnutrition. Second was uptake of vaccination. It was also highly correlated. Skilled birth attendant, either at facility or at home, but skilled birth attendant was very important. And family planning, especially for younger mothers. We identified these as very important factors. Now, with the beginning of COVID, it's only a couple of weeks back, I think 10 days back, we did another analysis, basically some sort of mathematical modeling to understand, how COVID is going to affect on these important factors. So what we found that if this service disruption, especially the health service disruption, continues in Bangladesh, it will result in, it will potentially leave 1.6 million children without oral antibiotics for pneumonia. So it will have huge impact on childhood disease control. It will leave 3.6 million children without DPT vaccination, with the current service disruption. It will leave 386,500 women without facility-based delivery, child delivery. And it will also leave more than 5.9 million women from without family planning services. So these figures kind of give you some idea, some very basic idea, how the current COVID through service disruption, going to impact on health and nutrition of our population. And altogether, if you look at the impact on mortality, there will be 37% more child mortality than what you have today. And we're expecting 19% more maternal mortality, than today. So the consequences are enormous, and I think as a country, Bangladesh government as well as NGOs, civil society, time is now for them to think through how do you want to mitigate these enormous health risks. Now, going back to the World Bank assistance, I don't know if you are aware, World Bank has taken a very serious step. At the global level, World Bank has allocated $14 billion, to programs around the world to mitigate the risk of COVID on health and other social services. For health in particular, the total allocation is 1.3 billion IDA resources, which includes Bangladesh, and $2.7 billion IBRD resources, which are made for middle income countries. As far as Bangladesh is concerned, today, Bangladesh already has $100 million assistance from the World Bank. This project primarily looks into how the government of Bangladesh, especially the DG Health, the Director General of Health, can strengthen their activity to address COVID, through the health systems. So that's where the majority of the money is going to be spent. The Asian Development Bank has matched this 100 million with another $100 million assistance. So the Director General of Health right now, they have $200 million to strengthen their health services to combat COVID. This is first phase. In second phase, Asian Development Bank has already allocated $500 million budget support to government so that they can implement all the programs that the Honorable Prime Minister has already declared, all the packages, packages. And the discussion of the World Bank is ongoing that World Bank will also step up with similar or even more amount to assist the government to implement their, all the packages in the social sector, like addressing unemployment, addressing low income, addressing social disruption, so on and so forth. So I think I will stop there. Over to you.
Thank you. Before I go to John, I want to ask one point from Reza Bhai because he has another meeting. Reza Bhai, what is your recommendation for government, for NGO partners and UN organization to manage this COVID-related nutrition problem in Bangladesh? Sound, Reza Bhai, sound.
In the previous discussions, I mean, John, like first I said that, I mean, urban poverty is coming as an issue. So we must have to be together, encourage government to find a strategy for the urban social protection interventions. And then this is one. And second is like, often the poverty crunch leaves the discussion towards solving the poverty issues. But again, we have to deal with nutrition and poverty together so that we do not forget again that we only eat energy-dense meal and others. So that we shouldn't forget that we had an excellent achievement to reduce stunting from 32% to 28. But then we have to keep that pace. Otherwise, situation can really deteriorate because of the situation now. And third is like coordination. Some of the things also John mentioned that like and also Jiabai that I mean the governance issues like distribution resources are there. The problem is resources one, but at the same time, how to reach out to the most needy is one. So the strategy has to be rethought. And I tell you that this COVID will not go away tomorrow. So there will be a new reality. I mean, new normal. And we have to look at strategies, how social protection schemes are implemented. And we have to look at the other options that we cannot keep the business as usual. We must have to be very creative and others and delivering services. And we have to define what would be the new normal behavior that we should also all include in our response options. And then coordination. So perhaps we have to improve coordinations, bring better discipline in distribution, decide on strategies, taking into consideration of the new normal, and at the same time, prioritize where we should pay attention. And I would say that not only poverty we have to deal with, now is health issues, and then poverty. But again, we shouldn't forget that we must also advocate for nutrition because this is a long-term consequences. If we do not plan intelligently, we may even have somehow tackle poverty, but it is one of the things that we must have to pay attention to. Again, solving poverty will not solve also the nutrition as well. So we must have to think how we deal with both of this. At this stage, I would say these are the 4 or 5 recommendations that I would say. And NGO, development partners and government has to work together. It's not duplication of the resources. We shouldn't do, and we shouldn't be competing each other and doing the same thing differently. We must have to put the collective energy together so that we work together and complement rather than doing things from different perspective by many others. And in this situation, which is very difficult, challenging situation. So these are the 4 or 5 things that I want to put forward for discussion. Thank you so much.
Thank you, Rajab. Thank you for your nice recommendation and join with us. I'm going to John to.
So Shamima, if you allow me, I have another meeting. Sorry, I have to leave now.
Okay, no problem.
Thank
we
you.
are
Thank
at
you, John. Thank you,
Thank you,
okay,
John. Before I heard about your recommendation, there was a question for you from Bahrain. His name is Mr. Soeb. He asked that, when COVID came to Bangladesh, in the last few months, we heard that all the foreign people leave this country, but you are still in Bangladesh and you are working for this country. What is your motivation to stay in these countries and do work for Bangladesh?
I feel like this is why I'm here. And of course, I have a great, sentiment towards the people of Bangladesh. And, I've dedicated the whole time I've been here to these issues. So I feel like it's important that I'm here for this now. I didn't really think too much about it.
Okay, then what's your recommendation? What Bangladesh should do for managing the nutrition during this COVID?
Well, I think that this is such a, let's say, monumental impact or event that it will really redefine a lot of the relationships that exist. Certainly relationships between people and food. So I think that, just not just for the poor, but for urban consumers in general, I think there needs to be a lot of rethinking of the kinds of food that we want and maybe the relationships that people have with food. And I think things like farmers markets, trying to shorten supply chains and know more about our food, maybe having healthier food. I think those are all very important things. But also redefine the relationship that the urban poor have with the rest of the city and with the governments that govern. I think that there needs to be more investment in their capacity so that they're the ones who are really taking the initiative to support better coordination, to maybe even empower them to grow their own foods, as be a bit more independent in terms of food sources. Certainly, there can be a lot of improvements in terms of targeting and distribution of food through working with poor communities. There is a lot of capacity there, but not necessarily is that being mobilized or being tapped into. I think that also, ward level of government becomes much more important, and the connection between city corporations, ward level government, and urban poor communities becomes so essential that there is very good communication relationships there to better understand how to deliver food to those who need it most, and to be responsive and to be agile about that kind of response. So I hope, it's always difficult to say, it's important to take advantage of a crisis, of a good, the opportunity to bring about change. But I do hope it redefine some of those relationships that the poor have often suffered from, being invisible or not being working closely enough with government, to one where there is a much better connectivity there. And if not, I think that we're going to face, we're really all in this together. And so I think it becomes, increasingly important that new relationship, that kind of essence of a city for all is so important.
Yeah, thank you, John. Jia bhai, you have a question from Sadia Slum Khilga. She asks that how much money World Bank should invest in Bangladesh for nutrition. That is her question. And after that question, can you also add your recommendation for ensuring the nutrition services for the urban slum people in Bangladesh?
How much money we should invest in nutrition? I don't think this is a very straightforward question. It really depends on many factors. It depends on what you want to do, how much nutrition you want to buy with that money. A couple of years back, World Bank did a costing analysis in Bangladesh on nutrition, and that identified total need for the country to implement nutrition actions, priority nutrition actions over next 5 years. I don't remember the exact figure. I think Shamim, you can share with Sadia that figure, how much money country needs. But I think even more than how much money you need, more important is what level of efficiency you want to bring into the system, to make sure whatever money and resources you have, how we can transform it to better nutrition. Because unless you fix the system, unless you bring in efficiency, it does not matter how much you invest, you will hardly reach to your objective. So I think that is my response to the first question. In terms of recommendation, there's a long list of recommendations we can discuss. We can spend days. But right now I have, I think, two two areas of recommendation that I can state, given the current context. The first one is, I think we have to have a trade-off between the movement restriction, which is the lockdown, and minimizing disruption to business and economy. That means making an environment of economically active environment. So I think it's very important to understand where you want to draw the line. How you can have a trade-off between these two options, because from public health angle, yes, it is important that you restrict movement so that the transmission is slower. But even from the public health perspective, if you don't allow the health workers to visit homes or mother and children to visit health centers, you are basically putting yourself into a risk of, unmanageable disease and eventual high rates of morbidity and mortality. So that's one area of my recommendation. And the second area is, I think we have to be innovative. The government has to be innovative in terms of service provision. I don't think under this current, context, you can expect a lot of men and women and children will come and receive service from facilities. So the conventional facility-based service provision, I think, is currently challenged for many reasons. And you can see in the newspapers, what is happening in different hospitals and different places. So that is kind of raising people or reducing people's trust to the entire system. Also, it is generating negative perception towards the system. So you cannot expect too many people to travel and come to the facility and access service. So in that context, I think the government, NGO, civil society, they need to rethink the service delivery, how to bring the services closer to the doorstep, to the beneficiary population. So that can mean, introducing mobile health services, introducing mobile sanitation service provision. You come to the doorstep, provide antenatal care, provide iron folic acid tablet, deworming tablet, micronutrient supplements, other health services. So I think we need to understand how we can make this service provision more context appropriate, what is happening. But even if you say, if you are very lucky and the COVID is managed towards the end of this year, I don't think the trust that people have lost in today or in last or in coming months over the system, I don't think that is very easy to, get those people back to the trust. It will be big time consuming. So in the meantime, you have to have alternative approach of service provision, without which, the indicators that we've been seeing some improvement on, like nutrition indicators or immunization indicators or birth attendant or other MCH, RMNCH indicators, these indicators got to slow down or go downwards, unless you bring innovation in service delivery. I will stop there.
Thank you, Jiabhai. Thank you. We have already crossed 9 minutes of our scheduled time. From eminence and gain, we like to convey our gratefulness to you, Jiabhai and John. It was a very excellent discussion. And I hope that the last point Jiabhai mentioned about that mobile services, I think this is an innovative services, and it can be integrated health and nutrition and food services, and ensure to access of these all services up to the door level of the poor people in the slums areas, in city areas. So now we are going to finish our program. Thanks you, and we are also inviting you to join with us again on 30th May at 3 p.m. with us again. Thank you so much. Thank you.
Thank you very much.
Thank you. Thank you very much. Thank you, John.
Everybody. Thank you, Zia. Thank you, Shami.